understand who you're working for. Is it private equity or is it private practice?
So I have on here servant leadership. There must be a note somewhere here about you talking about that. What does servant leadership actually mean in a clinical environment where the stakes are people's health?
So, from my standpoint, how I see that and my takeaway from that specifically is, in my position as a COO, what can I do to help you? Right? And I say that all the time. If you need me, call me, text me, email me, whatever it is. I want to be able to help everybody I possibly can. And is that able to be accomplished every day? No. There's some things that, I can't do in that day, just time basis, or, I'm doing something else or I have a meeting elsewhere. But I want to serve others. I want to serve the people who are driving the business from a hands-on provider perspective, right? So if Susie, going back to Susie, if Susie needs something, I want to be able to help her with whatever that might be. If it's connecting with the doctor, if it's communicating with the MRI facility to get the report, whatever it might be, however big or small, I want to be able to serve the people who, I am the COO for, and, help them with, maybe one task, one task a day, a week, a month, a year, whatever it is. That's really where I see servant leadership coming from. I always say I work for them, not the other way around, right? That's where I lie my head, on that saying.
So private equity is buying up independent practices quite a lot. Is staying independent actually worth it? And what does it take to make that work?
A lot of hard work, a lot of communication, and a lot of combativeness of these private equity firms. Honestly. Yes, they are going after, the little guys. We've been able to hold tough against them, which is, something to say in itself. And I think it correlates to the type of treatment that we are able to give these patients, not being owned by private equity, being owned by, private. It's a husband and wife. They're both chiropractors, so they both understand what it means to have patients, and they still do. They have very small caseloads, but they have patients they've been treating for 20 plus years come in and still see them. So we've been able to hang tough against it. Yes, it's getting harder every single year. Insurance is not the best, especially nowadays. People see it from a consumer side. We obviously see it from a business side. But like I said, I think it feeds down from the top down, right? And this is something I use when I'm interviewing people, is understand who you're working for. Is it private equity or is it private practice where the owners are, like I said, providers, and they know what it means to treat patients, because that's going to filter all the way down, down to the, rehab technician level and front desk level. They're going to feel that, all right, they're all about money. They're all about business. They're all about KPIs and numbers, and they don't care about anything else. Yes, that is something we care about, but we also know what it means to treat patients, right? And that's a resonating point when it comes to, especially providers coming out, is they want to know who they're working for, and they want to know that they're going to get that mentorship from a positive angle, and not from this, head honcho businessman, private equity firm who is just worried about numbers and hitting their benchmarks, KPIs, and that's it. Like I said, that is of importance because we are a business at the end of the day.
Mm-hmm.
We also understand the other side of things, of what it means to take care of people.